Hi. I just heard my phone go off. It is Steve again, Steve on PVCs. This isn't so much PVC related, but it is cardiac related, and anybody that has PVCs, SVT, if you're like me, everything fucking bothers you. So lately I've been just having an incredible amount of chest pressure, pain under the sternum, and you know, with the PVCs and the SVTs, I start thinking, you know, am I dying? Is this it? I mean, is any moment I'm gonna just, you know? So you start worrying about that. You start thinking, I gotta have people around me all the time in case I collapse. I need somebody to save me, rescue me. And it's really debilitating. And for somebody who's in the mental health profession, you know, I utilize all my skills and all the tools in my toolbox, but sometimes this stuff grabs you by the ass and pulls you down, and you just, it's hard to get back up. And you can have the best support in the world, but it's in here, and it's in here, so it controls you. You know, if you're like me, I feel every PVC. I feel every one of them. And if I feel differently, even without having a PVC, like for instance, if I feel a little nauseous, I was like, is that my heart? Is that my heart? Everything's my heart. Now, I keep in mind, I've been having echoes and stress tests. I've had a heart cath to check for blockages back in 2005. I have an echo every year, every couple of years. I had a stress test, and everything's always come back fine, right? No blockages, structurally normal, heart is strong. But I still worry about it because it controls me. It does. It to quote Dream Theater, it pulls me under. And I fight and I struggle with surviving this. But recently was a little different. This past Friday, this being the May 16th, 2019. Excuse me. I went to the ER. It just became too much. I thought, am I having a heart attack? Do I have a blockage? What the fuck is going on? So I get to the ER and they hook me up and the EKG's fine. So they give me nitroglycerin and 4 baby aspirins as precautionary, you know. The nitroglycerin opens up the valves, the heart, the vessels and all that stuff. It gives you an incredible headache. And then the baby aspirin keeps you from clotting. Well, I still had the chest pressure and all that stuff all day. And they also do a test for blood enzymes, because a certain enzyme can be released under a heart attack. And all this was negative. Everything was negative. I spent the day in the hospital under observation. And the doc comes back and says, given what I've told him, because sometimes Rolaids will fix this, and you know, different things will make it go away, and some other GI things I don't want to get into. He says, I think you just have heartburn. He goes, and I think it's bad. So he sent me home. But my cardiologist wants me to do a stress test with echo to see if this is a blockage, because when I exercise, sometimes I get nausea. Now I know I'm going to get short of breath because I'm fat. There's no way around that. Until you get in shape, you're going to breathe hard. But it's still worrisome. So that's where I'm at. And you know, I'm not alone. I mean, I read online all the message boards and stuff from people struggling with something similar. So what do? You know, I've got to support a family. You know, my wife helps as much as she can, but I got to be alone sometimes, and that can be a little scary. I mean, right now I'm home alone with the birds and the cats. The cats, I love them to death, but are useless when it comes to an emergency. So what do we do, you know, when we have all this going on? Well, I just get prepared, and I think it helps. You know, I have aspirin in my pocket. I have water just in case, you know. And I have my phone handy at all times. As he looks around for his phone. It's right there. So it's difficult to manage. It's difficult to live with. And it's just like in the hospital, man. Doctors don't make this any easier. There's very little reassurance. Every doctor that came in, for the most part, just was wham bam and out. You know, the ER doc was pretty good. He wanted to wait for all the results, but he's like, okay, the observation doctor, the cardiac people want to keep you for observation because of the risk factors. I'm fat, and I'm 47 years old, and I'm sedentary, so you know I have high risk factors. But I also have a history of having cardiac test out my ass. So which is it? You know? In 2005, I had a heart cath. My arteries were perfectly clean. Zero, no blockage. You know, everything was great. I've had 3 stress tests, echo with, I forget what they call it, but it's with the nuclear imaging and a CT. And everything has always come back wonderful. So in 2 years, can you get a blockage and die? I don't know. That's the question I'm going to ask because I forgot to ask it. So I guess the point of all this story is, the moral is that it's always a battle. You know, and I guess we have to start thinking that if you have 100 tests, are we hoping for that 101 to tell us that we have a serious problem that's going to kill us? Or do we learn to accept the 100 tests that say everything's fine? I've had at least 4 cardiologists and they all tell me I'm fine. So what am I looking for? What are we looking for when we continue to have these tests done, when we continue to try to find people to tell us there's something wrong? Because we think something's wrong. I feel something's wrong. People's hearts shouldn't do that. You know, it shouldn't play drums in your chest. It shouldn't bounce around. And it definitely should not take off and go over 200 beats per minute. But that's where I'm wrong. And I think that's where a lot of us who are in this boat get this wrong. And I'll be the first to admit it, we get it wrong. Because that can happen. It happens to a lot of people. The heart's not perfect. The cardiovascular system is not perfect. Now, when I say I read a study, it's not an article you pop up on Google and, you know, it's like health.com or something like that. These are actual research studies and journals. And they will tell you that a healthy person under continuous cardiac monitoring will have PVCs, SVT, VT, ventricle tachycardia, the one that seems to be scary, I guess. And they have all these things. I actually have a friend, a colleague, if you will, who told me that she has a trigemic heartbeat, but she doesn't feel it, and she leads a normal life. But some of us, we feel them, we get them, and they tear us apart. I wish there was an answer, but I will give this piece of advice, and it's just advice. It is to go back and count how many times a cardiologist or a doctor says you're fine. You have PVCs, you have SVT, you have AFib, and if they say you're doing everything you can, then you're doing everything you can. Now, AFib, I can't really speak to because I don't have it. I've read quite a bit about it, but we're all victims of our hearts, not in the fun way where we get to love and blah blah blah. It's the sucky way it's debilitating. You feel every heartbeat. You know, you get that weird feeling in your chest and you think, I'm gonna die. This is it. And I don't want to die. I haven't met anybody that wants to die with these things. That's why we fight so hard. But we have to ask ourselves, at what point do we accept what the doctors say? I mean, if we get a first opinion, a second opinion, and a third opinion, in my case, 4, and they all say the same things, if I go visit the Mayo Clinic or the Cleveland Clinic or some heart specialty clinic and they tell me the same thing, what happens after that? If you see the best in the world, they're all going to tell us the same thing. You're fine, you get this shit. But unfortunately for me, I can't take the medications. I can't take flecainide, I can't take the other stuff, beta blockers and all that stuff. I can't take those things. They make me too sick. I mean, in fact, beta blockers, I don't know if anybody else has experienced this. I mean, at a normal starting dose, my heart rate goes too low, my blood pressure drops, and I can't even breathe. So that is a concern. So I don't know if this helps. I'm gonna keep making them because, you know, I get the shit scared out of me, and I'm no delicate feather. You know, I'm not saying I'm the toughest person on the planet, but I'm not a delicate feather. But when we can't control what's happening, you know, especially with my type, is like, you got to be in control. If I can't control this, then I'm scared because I don't have it. You know, break my leg, I'm cool. Bad shoulder, I got a bad shoulder, bad clavicle, bad knees, bad back. I can handle all that stuff. But this is just not that easy to handle. So today I have a doctor's appointment with my GP. It's a follow-up from the emergency room visit, and we're going to discuss some GI possibilities, because it's quite possible that what I'm feeling is gastrointestinal. It's not cardiac. So we're going to discuss that and go from there. And I have an appointment to see a GI doc next week to see if it's a hiatal hernia or what else might be going on. So I think this time I've got to tell myself, if I have the stress test and echo again, the cardiologists are telling me it's all good, there's no blockages, the GI doc says it's probably this, then I have to accept that. Okay. But on an up note, on a high note, happy note, I've been trying to go vegan. For moral reasons, first of all, because I love animals. I rescue animals all the time. My family, we rescue animals all the time. You know, for instance, there was a hawk on the side of the road with a broken wing. Pick it up and take it to the Raptor Center. Just stuff like that constantly. Find dogs and take them back to their owners. All our cats are rescues. So, you know, that's the main reason, one of the big reasons I want to go vegan. Now, I'm vegetarian, I will say that, but I'm not quite vegan just yet. But as of today, I've lost 21 pounds. I don't know what that is in the English stone, you know. Is it like 17 pounds of stone? Man, if anybody's from England, tell me what a stone is as far as weight. So I've lost a little over 20 pounds. I feel better, and I've changed my diet, like I said, to more, it's mostly plant-based. I still do eat eggs and drink, I don't even really drink milk, but so it's mostly eggs. So, but I'm getting there. So 20 pounds lighter. I'm looking to get another probably 50 pounds, 55 pounds maybe off, and we'll see where we're at then. But anyway, thanks for watching. I don't care if you subscribe. I don't care if you leave comments. If you get something out of it, you get something out of it. But the message today is, like, at what point do we stop being scared and say we believe? I mean, because, to be honest with you, if it hits, you're dead. Nothing you can do. We don't want to die. But if you have all these specialists tell you, what do? Gotta believe it, right? We just gotta tell ourselves that, yes, we're scared, yes, these things are bad, and yes, we want to not die, but we're not going to. I've had PVCs since I was in my late 20s. I'm still alive. I have SVT. It's gone now, really, since I've lost the weight. But I'm still alive. I feel like shit some days. God, do I feel like shit some days, but we're trying to figure that out. But anyway, if you got anything out of this, great. If not, thanks for watching. And if you clicked off early, you're not even seeing this part of it. So I'll have more. Thanks for watching.